Do you frequently feel like your heart is pounding, even when you're just sitting? Or maybe you're gaining weight, especially around your face and belly, without changing what you eat. Have you noticed purple stretch marks on your skin for no clear reason? If yes, these could be clues your body is dealing with too much cortisol, a hormone that helps you handle stress. That's what happens in Cushing's syndrome. Imagine your body's stress dial is stuck on high for too long. It's like revving a car engine non-stop. Eventually, things start breaking down. Cushing's syndrome is rare, but when it happens, your body shows loud warning signs that something's off with your hormones. Cushing's syndrome happens when your body has too much cortisol over a long time. But why? Let us think of two main causes. First, some people take steroid medicines like prednisone for asthma, arthritis, or after an organ transplant. These help reduce inflammation, but act like extra cortisol. If taken for months, your body starts showing Cushing signs. Like adding too much salt to soup, it changes the taste. Second, sometimes tumors develop in the body. A tumor in the pituitary gland, a tiny brain gland, might send too many signals to the adrenal glands, on top of your kidneys, telling them to make more cortisol. Or a tumor in the adrenal gland itself might just produce cortisol nonstop. So, either medicine or tumors can turn your cortisol levels into a storm. Let's play a quick "Does this sound like you" game. Have you gained belly fat, but your arms and legs stayed thin? That's classic. Does your face look more rounded like a moon face? That's common. How about feeling super tired, but can't sleep well at night? That's cortisol messing with your rhythm. Maybe you've noticed easy bruising, like you bump your arm slightly, and it turns black and blue fast. Or purple stretch marks on your stomach wider than normal stretch marks. Mood changes. Feeling irritable or anxious without a clear cause. High blood pressure or sugar like diabetes might pop up even if you eat healthy. Women might grow extra facial hair or miss periods. Men may feel low energy or reduced interest in things. These aren't just getting older, they're signals your hormones are out of balance. How do doctors figure this out? First, they ask a lot about your medicines, mood, weight changes, and more. Then come tests, nothing scary. They might ask you to collect your saliva at night, yes, in a little tube. Why? Because cortisol should be low at night, but in Cushing's, it stays high. Urine tests over 24 hours can show total cortisol output. Blood tests check hormone levels like ACTH to see where the problem starts. Imaging tests like MRI or CT scans can find tumors in the brain or near kidneys. Once confirmed, treatment starts. If it's from steroids, the doctor slowly reduces the dose, never stops suddenly. If a tumor is the cause, surgery to remove it often helps. Sometimes radiation or medicines that block cortisol are used. After treatment, many symptoms fade. Imagine your body finally getting a chance to reset. Energy comes back, weight balances, mood lifts. Can we prevent Cushing's? Well, if it's from a tumor, it's not really preventable, like how you can't plan for a lightning strike. But if it's from steroid medicines, yes, with care. Always follow your doctor's dose plan. Don't take steroids longer or in higher amounts than prescribed. Think of it like driving. Stay in your lane, follow the speed limit. Your doctor may check your bone health, blood pressure, and blood sugar if you need long-term steroids. Eating healthy, staying active, and regular checkups also help your body cope. Also, never share or reuse someone else's prescription steroids. Prevention is about respect for your body and the power of these medicines. Science is moving fast. New treatments are being tested. Some medicines, like mifepristone or pasiridide, help block cortisol's effects or reduce its production, especially for people who can't have surgery. Doctors are also getting better at spotting Cushing's early using genetic testing and advanced scans. Some researchers are studying saliva tests that could one day be done at home, like testing blood sugar, but for cortisol. Others are exploring how our genes might make some people more prone to the disease. The big goal? To diagnose faster and treat with fewer side effects. Imagine a future where a smartwatch could alert you to hormone changes. That's where we're heading.